Good afternoon, everyone, and welcome to this webinar with Dr. Michelle Davis. My name is Ray D'Souza, and I'm the National Advisor for Workforce Wellbeing with Scottish Government Health and Social Care Directorates. And I'm responsible for putting this webinar program together over the next 6 weeks, which will run over the next 6 weeks. I'd like to welcome Dr. Michelle Davis. And thank you, Michelle, for agreeing to do this webinar for us. Michelle is a clinical innovation lead for anxiety at Big Health in San Francisco, and that's where she's speaking to us from today. Michelle is extensively published and has presented at several national and international conferences, and has a strong background in cognitive behavioral interventions with particular expertise in therapy for anxiety disorders and obsessive compulsive disorders. So Michelle is also going to introduce us to the Daylight app, and for those who don't know much about it, Michelle will say something about it. And I would encourage you to go onto the National Wellbeing Hub, because we have commissioned the app free of charge to all health, social care, and staff and carers. So please make use of it if you feel you need to. Michelle, over to you. And just before I do that, I would say to you, if you have any questions for Michelle, do use the chat box. And if you have any technical problems and freezing screen and all of that, just log out and log back in. That generally seems to resolve that issue. So welcome, Michelle. Thank you for speaking to us, and over to you.
Thank you so much, Ray, for that introduction. Hi, everyone. Thank you so much for joining today. I'm excited to be here and speak with you a little bit more about stress and anxiety. And just, yes, as Ray said, I'm a psychologist and currently working at Big Health, where we create digital interventions for anxiety and sleep. And first, I just want to acknowledge that many of you are likely experiencing a lot of stress and anxiety with everything that's going on. So I hope that some of the information that we discussed today will be helpful for learning a bit more about anxiety and how to manage it, or just getting a little bit of relief. So I'll teach you some techniques that you can start trying today to hopefully feel some relief. So the agenda for today is just to give you some background about stress and anxiety, what they are, why we have them, which will really set the stage for information about how to manage stress and anxiety. So there is a lot of mental health information out there. It can be really difficult to sort through what's evidence-based and what's actually been shown through research to be effective. So I will tell you about the approaches to treating anxiety that are founded in science. And then, as I said, I'll leave you with a few techniques that you can try today and tell you about what they look like in the Daylight program, which you all have access to. And then we'll leave some time at the end for any questions that you might have, so feel free to send those over throughout the presentation and we will answer them. So first things first, when I say anxiety or stress, what am I really talking about? Through our work with people struggling with stress and anxiety, we found that everyone kind of has their own word for what they're experiencing. And what they're actually feeling when they're stressed and anxious can be different for different people too. So some people will experience more physical or bodily symptoms of stress and anxiety. So they might notice that they feel very tense or restless, a tightness in the chest. At the extreme end of things, they might notice that they're having panic attacks, or they're having kind of a sudden onset of a lot of physical symptoms. And other people experience stress and anxiety more mentally or cognitively, finding that they're worrying a lot, feeling like they can't turn their brain off at the end of the day, having kind of racing thoughts. But even though the words and exact feelings that people have in connection with stress and anxiety can really vary, the process by which people develop stress and anxiety is the same. So first we'll talk about stress. And some leading stress researchers, you can see the quote here at the bottom of the screen, have defined this more specifically, but I want to break this into a simple formula, which is that people experience stress when they perceive a threat, or they have a thought or a belief that something bad might happen, and that perceived threat exceeds their perceived ability to cope. So stress happens when we detect that something bad might happen and I'm not sure I'll be prepared to handle it, or I don't think I have what it takes to cope with it. And once stress is triggered, there's a sequence of changes that in the body. So stress is really can cause a lot of physiological changes that all begin in the brain. So when we detect a potential threat, something bad that might happen, our experience of fear triggers activation in an area of the brain called the amygdala. And the amygdala then sends a distress signal through the rest of the body, which triggers the release of a ton of stress hormones. So things like adrenaline and cortisol. And these really serve as a gas pedal for physiological changes. And the changes that you experience can be different depending on if you're faced with something that's immediately potentially threatening to you, which might result in something like a panic attack where your body's really preparing you to respond to that situation. But also if you're worrying about something that's going to take place in the future, those physiological changes can look a little bit different. So they can look more like the tension, restlessness, and feeling just kind of wound up that I spoke about earlier. But the physiological changes that can be caused by stress are things like increased heart rate and blood pressure, increased sweating, blood vessels and pupils dilating, your blood flows to your muscles, your digestion slows. So sometimes people notice gastrointestinal symptoms related to stress and anxiety, and quickened breathing. And these physiological symptoms themselves can often be really bothersome for people and can make them worried that something's wrong. But this is really the fight or flight response or the stress response that prepares your body to deal with a threat. Now, that's the stress response, but how is anxiety different from stress? Anxiety is often triggered by stress and includes really similar physiological effects, but it's more than just stress alone. So anxiety is really a persistent pattern of symptoms that occur over a longer time frame, which form a vicious cycle that maintains the anxiety. So I'm going to give you an example that might be familiar to you. Imagine there is a stressor. And in this case, we'll use an upcoming talk to a large group of people. So this might create some initial stress. I know this has been the case for me at times, especially when I first started giving presentations, and true fact, it is actually the most common source of stress. But this stressor will just cause stress, but lead to anxiety if the presenter started having negative thoughts like, I might stumble, they won't like the talk, I might sound like I don't know what I'm talking about. And then that can lead to or bring on physical symptoms of anxiety. Trembling hands, sweating and heart racing, feeling like your mouth is dry. And then those symptoms can lead to behaviors that serve to try to avoid those physical effects or avoid the anxiety. So things like procrastinating, preparing for giving a talk because you don't even want to think about it, or opting out of giving a presentation, calling in sick to work, skipping it altogether. And of course, when you don't properly prepare or you avoid the presentation entirely, you don't get to see that it might go just fine. So you continue to go around in this vicious cycle where the next time this stressor comes up, you'll have the same thoughts, same feelings, and same need to avoid by engaging in these behaviors. And all anxiety is defined by this vicious thoughts, feelings, and behaviors. And really what keeps this cycle going is these avoidance behaviors. So we call this an avoidance process. And avoidance can look like a lot of different things. It can look like even cognitive events, so things in your mind, worrying about something excessively, kind of ruminating about something that happened in the past. Anything that keeps you from really facing the thing that you're afraid of or stressed about, and learning that you can cope with it better than you think. So throughout this presentation, I'll bring up some myths and kind of bust them. So the first unhelpful myth is that anxiety is bad and something to get rid of. So too much anxiety definitely feels bad. I'm with you there. But just as we discussed, a healthy anxiety response is an important part of human survival. If we didn't have any anxiety, we wouldn't be able to function. So the goal is not to get rid of anxiety completely, which would be impossible, but rather to learn to master it rather than to be controlled by it. So if some stress and anxiety is too much is bad, what is the right amount for human functioning, or when does it go too far? This curve can answer that question. So the curved line that you see here depicts human performance in relation to how much stress you're feeling, from low stress on the left to high stress as you move towards the right. And you can see that peak performance is actually when stress is right in the middle. In other words, when you have a moderate amount of stress, enough to get you energized, focused, and alert. If you move too far to the left, you can see that performance goes down because your stress is too low, you're too laid back, don't have that energy. And if you move too far to the right, your performance also goes down because your stress is so high that you're really overloaded or panicked or exhausted. So the key is really to find your own sweet spot of stress that gets you to that optimal level of performance. And we'll talk about some ways to reduce stress if you find that your stress is veering towards the right side of this graph. Okay, so we've talked about stress and anxiety kind of more generally. Everyone experiences it to varying degrees. It's important for survival. But when does anxiety turn into a full-fledged anxiety disorder or a diagnosable mental health condition with a specific set of symptoms that really gets in the way of someone's life and keeps them from living the life that they want to live? So how someone develops an anxiety disorder is a really complicated process with a lot of different inputs. And this diagram shows the factors that we know to be relevant for the development of anxiety disorders. So there's what we call predisposing risk factors on the left. These include things like genetic risk factors, which would be a family history of anxiety or depression. Environmental risk factors, which are things like early adverse life events like trauma or living in extreme poverty. Having one or both of those doesn't mean someone will absolutely go on to develop an anxiety disorder, but it does increase the likelihood. And what leads more immediately to the development of an anxiety disorder is similar to that stress equation that I showed you earlier. So it's really the balance between the amount in someone's life and the amount of protectors in someone's life, or protective factors. So stressors include things like bereavement, health issues, work difficulties, financial troubles, transitions, things like dealing with racism, financial concerns. And protective factors include things like social support, so feeling like you have support from others, coping skills, personal resources, and coping skills also include the skills learned in evidence-based treatments for anxiety, such as those I'll be discussing shortly. So the path for any individual is complex. There's a lot we still don't know about how anxiety disorders develop, but what we do know is that these pathways aren't set in stone. So there's people who load high on all of these risk factors who never develop an anxiety disorder, and there are people who have no obvious risk factors that do develop anxiety. But what we do know is that increasing these protective factors and reducing stressors are both powerful ways of reducing anxiety, either to prevent the onset of an anxiety disorder or to manage anxiety if someone does have an anxiety disorder. And this brings us to our second myth, which is that anxiety is solely due to a chemical imbalance. So many people think if I have an anxiety disorder, it's hardwired into me, that's just the way I am, it's all purely chemical. But as you saw, anxiety develops a complex process that may be partly genetic, but is more often based on environmental factors, so things like stressors and protectors. So anxiety is a normal human experience that can get out of control, but there's not a lot of evidence pointing towards fundamentally different brain chemistry in individuals with anxiety disorders versus those without. And then this third myth here is that anxiety is rare, or anxiety disorders are we know that everyone experiences anxiety as part of life, and many experience anxiety disorders. So even before COVID, where we've seen that anxiety has really been exacerbated, even before that, nearly a third of individuals will be diagnosed with an anxiety disorder in their lifetime. So that's all to say that anxiety is not rare, it is human. Okay. We've talked about the problem, so now I want to get into the solution. So you all might be very well aware of this, but first, just to kind of back up, doctors and healthcare providers come to an agreement on what the best treatments are for a given condition by reviewing what's been shown to be not only most effective in research studies, but also considering safety. And these are then written up into treatment guidelines, and they'll describe like what are the first line treatments for a certain condition. And for anxiety disorders, treatment guidelines recommend either certain medications or a specific type of psychotherapy. So the medications that are recommended are often antidepressants or SSRIs, SNRIs. Often people think of these as only being used for depression, but they can also be helpful for anxiety disorders, though they do often come with side effects. The recommended psychotherapy for anxiety is cognitive behavioral therapy, or CBT. And this is really the treatment for anxiety, and the option I'll be talking more about today. Quickly, we'll unveil two more myths. One is that medication is the best treatment for anxiety. So many people think medication is the only treatment option for anxiety, which you know is not true. And just like drug companies conduct clinical trials to research whether medications are safe and effective, CBT has also been researched in this way, and in these trials, research has shown that CBT is as effective for anxiety disorders as the leading medications in the short term, and in the long term, it can be even more effective. The great thing about CBT is you don't have to keep taking it, so you're learning skills that really change the way you operate, which can help reduce anxiety long term, whereas with medications, you have to keep taking them to get the benefit. And as I mentioned, CBT also doesn't have some of the physical side effects that anxiety medications can often cause. And so this next myth is that medication and therapy are better than either one alone. So people often think if medication and CBT both work, why not just give people both? But we actually see in the research that the research doesn't really support this. So there have been studies comparing medication or giving medication and therapy separately, and we see that they don't offer much benefit to combine. So for some individuals, there can be a benefit or a reason that your treatment provider might give you both, but typically in the research, we don't see that combining medication with CBT gives much of a benefit over CBT alone. So we'll talk more in detail about specific CBT techniques later, but just to say that the way to tackle anxiety isn't always intuitive. So because these unhelpful thoughts and behaviors described can keep anxiety going, CBT involves learning techniques to identify and alter those thinking and behavior patterns that really keep people stuck in this loop, whether that's learning how to reframe their thinking or to respond differently to anxiety. And I think it's important to note that many people know about CBT, but they might not know it's not just a simple set of quick tips or tools. It really is an in-depth treatment that includes a range of techniques that really need to be practiced and learned and developed into skills over time. So there are tools both to target unhelpful thoughts or cognitive techniques, and tools to target unhelpful behaviors or behavioral strategies. And traditionally, how CBT works is that someone would meet with a therapist in person for weekly sessions, and typically over the course of about 12 to 16 sessions, the therapist would introduce specific CBT techniques and help the individual learn to apply those that are most relevant to their life and really have them practice them over and over to the point that they become automatic. And this is why you don't have to keep CBT forever. You're really learning new skills and new ways to respond to anxiety. And the benefits of CBT, again, last beyond when the treatment is completed. Unfortunately, in-person CBT is not always widely available, especially here in the States, more so where you are. But when it is, it can be quite costly. In times like this, it can be difficult to access. But luckily, we know from research that CBT doesn't have to be done in person in order to be effective. There's been a wealth of research showing that CBT can be effective in self-help formats or via telehealth. And this is where daylight comes in. So we've developed a program for learning cognitive and behavioral techniques to manage worry and anxiety on your own with our digital product called Daylight. And as an NHS health and social care staff, you have access to Daylight via the link here, which I think we can also share in the chat. But as I talk about some of the techniques for managing anxiety, the CBT techniques, I'll show you what it looks like in Daylight. So if you decide to use it, you'll have a sense of what it'll be like. And because it's really important not just to say CBT is effective, so this program Daylight must be effective too, it's really important to specifically test digital tools like Daylight to make sure that they are safe and effective in this different format. So I want to spend a few minutes talking about the results of a randomized controlled trial that we conducted using Daylight. So we enrolled 256 participants in a research study and randomly gave half of them access to Daylight and the other half had delayed access. They're called waitlist control here. And we measured their anxiety using a measure called the GAD-7, which is a measure of how severe and problematic anxiety is for a given participant. It's a screening measure that's predictive of people having an anxiety disorder. And the GAD-7 has a cutoff score that indicates at what level anxiety is clinical or severe enough to be considered a disorder and warrant care. And you can see that all participants here started in the elevated clinical range. So they started with an average of 15.6. And if you look at the waitlist control group, those who did not use Daylight, this dashed line, we saw that they did not drop below that clinical anxiety threshold, the GAD-7 of 10, and stayed elevated throughout the 10 weeks. And this is what we would expect if someone doesn't receive care. They tend to get a little better on their own with time as they kind of learn to cope with anxiety, but don't see significant improvements that move them into that subclinical or healthy range of anxiety. Take a quick drink here. However, if you look at this orange line here, this is the group that used Daylight. We saw that by the week 10 follow-up, they had dropped to a score of 7.9, which is in the healthy range of anxiety. So we saw that Daylight significantly reduced levels of worry and anxiety compared to waitlist control, and actually saw that 71% of people who used Daylight moved from a clinical or unhealthy range of anxiety to a non-clinical level. I think it's important to note here that these are users who didn't just try the program once. These are people who actively engaged with the program and using it. So it's not a quick fix. It's definitely something that needs to be practiced and really focused on. But we've also gathered real-world evidence from, sorry about that. We've continued to gather real-world evidence which shows similar results of using this outside of a clinical trial, and our goal is to continue to build our research pipeline by testing the effects of Daylight in different populations. So we want to make sure that it works for all different kinds of people. So this leads us to the next unhelpful myth, which is that CBT or therapy in general must be done in person to be effective. Luckily, given the current situation, we know from research that CBT works with a lot of different delivery methods, whether it's in person or via telehealth or with self-help materials or digital products like ours. Okay, so let's move into techniques. The first technique I want to tell you about today is a cognitive technique. So this is focused on managing your thoughts, and it is a technique called worry scheduling. So this can be helpful for people who experience their worries as uncontrollable. So I mentioned some people feel like they can't turn their brain off, or they can't focus on what's going on around them because they can't kind of get away from their worries or get out of their head. Worry scheduling is intended to counteract that uncontrollability that people often feel with worry. And this is a technique that we have in Daylight that we call worry time. And I'll show you a quick clip of the video before describing the exercise itself. So this is how worry time is introduced in the Daylight program.
If you've been doing a lot of worrying lately, you're probably sick of it. but it can feel impossible to stop cycling through those same thoughts over and over again. Worry time is a technique that can help you take back control, so worrying doesn't take over your mind. It's quick and effective. You'll pick a regular time and place, and only that time and place, to let yourself worry. It's kind of like how when you eat dinner at the same time each day, your body learns to get hungry at that specific time. And outside of your scheduled worry time, you can give your mind a much needed break from all the constant low-level stress of worrying, which, I don't have to tell you, can be exhausting.
Okay, so that is how worry scheduling, or worry time, as it's called in daylight, is introduced. So just a quick note about daylight. We've tried to really break down these techniques into quick videos that describe how the science behind the technique, how it works, describe the technique itself, and then give practice exercises where you can actually log in each day and practice this technique called worry time. So that is what it looks like in daylight, and I'll take a little time to explain how this technique works. So this technique takes advantage of the fact that our brains associate certain things in our environment with certain activities. You just heard an example. Another example would be like if you ate dinner in front of your television every night, you might notice yourself starting to get hungry when you sit down at your TV at other times. So your brain has formed an association between the television and hunger. If you've used our other program called Sleepio, we talk about this there, about how important it is to have an association between your bed and sleeping. So it's really important not to be in your bed when you're not asleep. For this technique, we want to use this phenomenon, which is called stimulus control, to your benefit by training your brain to associate a certain time and place with worrying. So we want to have you worry in the same time and place every day, so that when you go to that place, your brain is ready to worry. I'll describe how that works for worries that pop up outside of worry time. But what you do for this technique is first schedule a specific time and place each day. You want it to be pretty specific, so say 5 p.m. in a quiet corner of the living room. Don't pick a fun place to associate with worry, and if you can, try not to pick the bedroom. I know people have limited space. I'm working in my kitchen right now, but try to you can even put a pillow on the floor in a certain area and have that be your worry pillow. But during that time, that's where you're going to really focus on your worries. So, I should also note, I know people often have varying schedules and aren't able to do things at the exact same time every day, but the goal here is to really try your best. If you can't do it at the exact same time every day, at least try to do it in the same place and vary the time if you need to. The goal here is not perfection, it's really to just try to intentionally set aside a time for worrying. So outside of that time, you want to practice delaying worry until that specific time. So if worries pop up outside of that time, which they inevitably will, especially in the beginning, you want to make a mental note. You can jot down the worry and remind yourself that you have a specific time and place to really focus on this worry later. So we're not very good at, throughout the day, really tackling our worries or doing anything productive with them. So reminding yourself, hey, I have a specific time to think about this. I'm going to wait and really focus on this later. And then when worry time comes up, you can either just let yourself think about the worries, let yourself kind of cycle through the different worries that are in your mind, or you can focus on one worry specifically. So you can get a piece of paper and do some problem solving with that particular worry. Sometimes it's enough to just sit there and let yourself feel anxious and let yourself think about the things that you're worried about. But if you find that it's a stickier worry, it can be helpful to do some problem solving. So what's hard about this technique is not just sitting with your worries during worry time, which might be challenging in and of itself, but it's really difficult at first to bring your attention back to the present when you notice worries popping up outside of worry time. It'll take a lot of practice. It'll be challenging at first and you won't be good at it, but just keep reminding yourself to try to bring your attention back to the present and that you'll have time to tackle these worries in a more efficient way later. And if this is simple or too easy to do, you're right. This technique and most other CBT techniques aren't quick fixes or tips. They're really skills that you get better at over time. So this is something that you would practice doing daily, and the Daylight app makes that an easy way to do it. Okay, so that's worry scheduling or worry time. Now I'll tell you about another cognitive technique, which is called cognitive restructuring. And this is a way of identifying unhelpful thoughts and then challenging them. And I will show you what the introduction to this technique looks like in Daylight, where it's called Thought Challenger.
Well, before we dive in, let's take a look at the bigger picture. Your mind is a mob of thoughts, and frustratingly, it's often the most negative and extreme thoughts that make it through the noise and dominate your attention. With this in mind, it's critical to remember this simple phrase: just because you think it doesn't make it true. What do I mean? Imagine you send a text message to a friend and she doesn't respond right away. All of a sudden, your negative thoughts take over. I probably offended her. I shouldn't have said that thing. She hates me, leading you to the conclusion our friendship is over. When you finally do get a text back, of course, you learn that your friend's phone had been out of batteries the whole time. She definitely doesn't hate you. Just because you think it doesn't make it true. You see, your mind is doing something quite common. It's catastrophizing, or jumping to the worst case scenario. It's not giving much thought to the more likely possibilities. And this is something your mind will do for little things like worrying about a text message, to big things like a serious health concern. We often forget that we have the power and the right to question our thoughts, to put them on the stand, make them sweat. They're ours after all. We can do with them what we want. And that's what we're going to do together. First, we'll identify your negative thoughts, get to know them, learn to call them out. Next, before we assume the worst, we'll learn how to cross-examine them and discover a new and more productive way to think. Let's take a closer look at your thought. Is it catastrophizing? Is it jumping to conclusions and thinking the worst case scenario?
Okay, so this is what Thought Challenger, which is a cognitive restructuring technique, looks like in Daylight. I want to point out that the exercise I didn't show you here, but it first asks you to try to identify whether this thought is true or not. And I want to point out, especially right now, there are a lot of thoughts that are true, that are very distressing, and that are not inaccurate. So Daylight actually walks you through if that thought is true, if it's something that you're not, kind of catastrophizing over, walks you through. If it is true, how can I cope with it? What are the resources that I have to manage this? How can I cope with this? So I think that's really important to point out, because a lot of times people think cognitive restructuring is all about telling you your thoughts are wrong or inaccurate, when in fact, a lot of your thoughts are accurate. When there's really difficult things going on, we're going to have difficult thoughts that are accurate. So cognitive restructuring is not just about telling you your thoughts are wrong, but it's also about giving you kind of a different perspective about how you can cope with something if it is true. So just to walk through how this technique works, first you'll identify an anxious thought, and you could do this in the Daylight, or you could just write it down on a piece of paper. And your anxious thought could be like a worry about the future, a worry about something bad that might happen. And you want to first rate your belief in this thought. So how much do you believe it to be true? Is it 100% true? Is it 80% true? And also how anxious it makes you feel. So from 1 to 10, where 10 is the absolute worst and 1 is, oh, I think I can, that doesn't really bother me. You want to rate how anxious it makes you feel. And you can also write this down. The Daylight app will prompt you to enter it. And then you want to ask yourself a series of questions and really challenge that thought. So if it's a thought where you think you might be catastrophizing or kind of blowing it out of proportion, ask yourself things like, what evidence do I have that this is true? What evidence do I have that this is not true? Have I had thoughts like this in the past, and what happened in those situations? If I were to ask a good friend about this, what would they tell me? What would that kind voice of a friend look like? And then if the thought is true, how would I cope? If you have a role model that you really look up to, thinking, how would this person handle this? What would they do to cope with this difficult thing? Have people dealt with issues like this in the past, and how did they survive? How did they get through it? So really sitting with that thought, asking yourself a series of questions about it, and then at the end of this session, re-examining if the thought is maybe not accurate, how much you believe the thought now. So even a shift from believing a thought from 90% to believing it 80% can be a lot to really reduce some of the anxiety that you feel because of that thought. And also rating how anxious it makes you feel. So you'll find that over time, and again, this takes practice, but you'll find that over time, as you repeatedly challenge these thoughts, that you're better able to do it in the moment. So this is something that in the beginning, you really want to, just like with worry time, you could schedule a specific time to do this. You really want to do it each day and think back to yesterday when I was really anxious, what thought was running through my head when I started to feel very anxious. Identify that thought and kind of work through this exercise. And really intentionally pay attention to what you're thinking. And over time, you'll get better at noticing kind of this automatic thinking that occurs in the moment, which isn't always accurate, sometimes is, and get better at responding to it. So it's really about changing perspective, kind of changing that voice in your head that might automatically tell you can't cope with something or you can't handle it, and really giving you a more helpful voice in your head. So again, this is something you can or do on your own. The next technique I want to talk about is actually a behavioral technique. So this is a technique called brief applied relaxation. And this is a way to change your behavior in order to change how you feel. So a lot of times I think, especially when you're worrying about things that are very real problems, it can be helpful to change your behavior instead of changing your thoughts, because when you're really anxious, sometimes we're not very good at being rational in the moment when we're really worked up. So this technique is called brief applied relaxation. I have a colleague who also calls this behavioral Xanax, which is a medication that can make you relax very quickly, but can cause a lot of side effects. But this is a way to, in the moment when you're feeling very anxious, handle that anxiety. And it's different from just relaxation. I know when you're anxious and someone tells you to just relax, that is not helpful, but this is a different take on it. So I will show you a video of what this looks like in daylight.
We've all been there. We're getting irritable, distracted, cranky, and then it hits us. We're hangry. That brutal combination of hungry and angry. We don't need therapy. We need to eat something. In this case, it's our body that's causing us trouble, so attending to our body is the solution. The same actually goes for anxiety. When you're feeling worried and anxious, you may think it's all in your head. But just like when you're hangry, a lot of the stress is actually coming from your body. In this case, your tense neck, back, and shoulders. And if that tension is a big part of the problem, releasing it can also be the solution. Now, you may be thinking, sure, try to relax, easier said than done. And you're right, trying to force yourself to relax often just makes you feel more tense. So here's the twist. Instead of trying to relax, I actually want you to tense up. That way, when you release all of that tension, you'll benefit from a natural relaxation response in your muscles. Your body won't have any choice but to relax. This exercise is called tense and release, and it's the first step in helping you learn to completely relax your body, which in turn will relax your mind, anywhere, anytime.
Okay, so that is what brief applied relaxation looks like in daylight, where it's called tense and release. So again, research shows that relaxation techniques don't tend to work for anxiety if you're just trying to relax when you don't feel anxious, but this version of relaxation is actually effective on its own for managing severe anxiety and the kind that people have when they have anxiety disorders. So the key is that doing this when you feel very anxious to try to counteract that anxiety can be very helpful. And again, this is one that you practice over time and you get better at relaxing in the moment. So what you'll do in this exercise, and we can do it together here if you'd like, but you want to sit in a chair or lie down, so you want to be in a comfortable position. And again, this technique is all about not just trying to relax, which doesn't work very well, but actually tensing up your body in order to kind of force a relaxation response. So actually generating tension, becoming aware of where there's tension in your body, and then letting it go and relaxing. So you want to take a deep breath in, and at the same time, you'll tense up the muscles in your legs, your belly, your shoulders, and your arms, and you really want to squeeze everything in tight, hold it very tight. If you have areas of pain, you can avoid tensing those areas. And then you want to hold that for a bit and then slowly exhale and release the tension. And when you release it, you want to really overdo it, really relax, kind of slump into your chair, let your shoulders droop, let you breathe and exhale. You can whisper or think the word relax to yourself or release to yourself, any word that sends you a signal of this is relaxing, and really try to visualize that tension fading away. So the first time you do this, you might not feel relaxed right away, but this is something you do in cycles. So each time you do this, you tense up and release your muscles. You're forcing that natural relaxation response, where your muscles eventually, after you do this repeatedly, don't have any choice but to relax. So you're kind of tiring yourself out. It's similar to exercise, where at the end you've just kind of drained yourself. But is that you want in between each cycle of tensing and releasing, that it's not a stressful thing. So you're taking deep breaths and you're doing this slowly. There's a lot of different versions of this, but a lot are quite long and complicated. And I find that tends to get in the way of people actually using it. So there's things like progressive muscle relaxation, which is great. You can look that up on YouTube, and there's some examples of it out there. But this is such a quick and easy version that you can do anywhere. In daylight, there are things that you can do in public that are kind of discreet. So if you are at work or something and you find yourself in need of a quick tension release, you could either pop in your headphones and do a daylight app, or after you've learned the technique, just do it without the app. But yeah, let's take a moment and do a couple rounds of tense and release together and see how it feels. So first, you want to take a large inhale and really tense up the muscles in your arms, your legs, squeeze in tight, puff your chest out, kind of like you swallowed a balloon. And then you want to hold it and hold your breath, and then slowly exhale and really release that tension. Really relax. Notice the difference between what it feels like to be very tense and to relax those muscles. Take some deep breaths. And then you can try it again. So take another large inhale, tense up, hold your muscles tight, press your chest outward, holding it. You can squeeze your thighs, and then slowly exhale and try to really release that tension. So this is something in the Daylight app. I think the first exercise takes you through maybe 4 rounds of tensing and releasing. But again, it's something you do in rounds, and it's something that you want to try to do over time. So your body will get used to that tensing and it generating a relaxation response. And especially if you say a word that indicates relaxation to you, and maybe a visual cue, so something like a beach or a country house that is relaxing to you, your brain will start to associate those things with relaxation, and the technique can get more powerful over time. So that's just a quick glimpse of what tense and release or brief applied relaxation looks like. So these techniques are all in the Daylight app. There's also one called worry exposure, which takes you through, if you're worried about a specific scenario, it takes you through, sorry, my dog to you also, takes you through what would it look like if this actually did happen? How would I cope? How could I handle it? So these are all in the. All right, and now I think we're ready for some questions. So I will stop sharing and can start a Q&A. And I will try to control my dog.
Okay, folks, Greg, do you want to come in with some questions? I have a few for Michelle, if...
Yes, absolutely, Ray. So first of all, thank you so much for populating those questions. Hopefully they'll be useful to the collective, not just the individuals who's posted them. So there was quite a lot of interesting themes coming through, Michelle. So I've tried to order them and to cover as many as I possibly can. So apologies if I don't get to your question, because there was a fair amount of them. So I'll just run through them, Michelle, and if you just do your best to answer them. So the first one's quite interesting. So it's based around theories that propose that adverse childhood experience, so particularly trauma and abuse, lead to chronic brain development changes. So the amygdala being constantly on hyperarousal, the accelerator system on full blow all the time. Do you consider there to be any efficacy in these theories, and can CBT help them?
Yes. So there's a lot of research around not only adverse early childhood events, but any type of trauma, that it can really have an impact on areas of the brain that are associated with anxiety. So people can find that they're experiencing hyperarousal, that they are kind of constantly on edge. The good news is that we know that even with events like early childhood trauma, which I should point out may require additional care beyond simply CBT for anxiety. So it may require some type of trauma processing therapy. But we know that these techniques can still be helpful in those individuals. So I think it's not accurate and not very helpful to think, because this happened to me, I'll never be able to function normally. So there are ways that you can learn to master and control anxiety, even if you've experienced early childhood trauma. But again, I do want to reiterate, there are specific evidence-based treatments for trauma that I've not talked about today. Yeah, if you want afterwards, I can send some information about what those evidence-based treatments are. But yeah, again, they're going to be the evidence-based treatments for trauma are CBT-based. So you may have heard of things like prolonged exposure, cognitive processing therapy, and treatments like that can be very helpful for trauma. So I hope that kind of answers your question. I didn't delve into trauma today because it is a little bit of a different problem.
That's great. Thanks, Michelle. So again, just a slightly different question, but probably one that's quite coherent across the group. So some people are not sure how to delay worrying as part of their schedule because the stress is work related and also work is piling up from dusk till dawn. So they're finding it difficult to find that time. How would you address that, Michelle?
Yeah, and you're absolutely right. If you're in the situation that is triggering the worries, it can be extremely difficult. So typically what the answer to that of how to delay worrying outside of worry time would be to try to engage very fully in an activity that stimulates you and that captures your attention. So first I'll answer if you're not at work. So if you're outside of work doing something that we all have activities that when we're engaged in them, we tend to get kind of lost in them. So it's going to be difficult, absolutely, in the beginning to try to engage in those activities when you're worried, but really trying to continuously bring your attention back to the present moment. So this is where things like mindfulness can be really helpful in combination with some of these CBT techniques, because it's all about noticing that you're having a worry in the moment and bringing your attention back to what you're actually doing in the moment. So when you find your brain kind of drifting off, trying to kind of rein it back in and focus, it can be really helpful to focus on your actions. So what is my body doing? What am I engaging in at the moment? What do I need to do with my hands? Focusing on senses. What do I hear that's going on around me? What can I smell? What can I taste? And those kinds of things can be helpful if you're in a situation where you're at work. which is likely triggering a lot of anxiety, focusing on the task at hand. And I want to emphasize this isn't easy, so I don't want to make it seem that way. It's something that takes a lot of practice, and it takes intention. So not just saying like, hey, I'm not able to do this, but really setting aside that worry time and if you try it for a week straight, I think you'll find that you are getting better at delaying worries in the moment, as well as processing your worry during your specific worry time.
Okay, thanks, Michelle. Okay, so in terms of when you talked about the escape behaviours, so there's a question around procrastination and how someone might deal with chronic, consistent procrastination behaviours.
Yeah, absolutely. And it's interesting. A lot of people don't think of procrastination as being associated with anxiety. So a lot of people think, oh, I procrastinate because I'm lazy or I don't want to work hard. But oftentimes it really is a way to try to avoid the anxiety that we have around something. And if you'll think back to that model of anxiety that I showed you of thoughts, behaviors, and feelings, that avoidance or that procrastination is really what's keeping the anxiety going. So the way to manage any type of avoidance is to start small, first to notice that you're doing it, and then challenge yourself to do the opposite in small chunks. So if you find that, let me try to think of an example. Anything that you're avoiding, if you find that you are avoiding doing your work, maybe one day setting aside 10 minutes to really focus on it, doing that for a week and then building it up. So the next week you're going to do 15 minutes. And it's really about kind of slowly building your tolerance for managing the anxiety that not procrastinating builds up. And we know from research that when you repeatedly do this over time, you train your brain to manage the distress that comes up with approaching these things. So starting small, doing things repeatedly. You could even make yourself a list where you say, okay, for this week, I'm going to do X to tackle my procrastination, and the next week I'm going to bump it up a notch by doing this, and kind of work your way through that list. Oh, I think you're muted.
Absolutely, I always do that every time. Sorry. So, okay. Okay, so there's a good question around, an interesting question around anxiety. Can it be a learned or inherited response from parents who have had mental health issues, particularly anxiety themselves?
Definitely. Yeah, so there's a lot of different factors that can influence whether or not you have anxiety, and that's one of them. So we know that this behavior can be learned. So imagine if you, I don't remember where I heard this example, but an example of a bird flying into someone's house and their mother had like an extreme reaction to this, just totally distressed by this bird, not knowing how to handle it, having a meltdown. And then that child learned, birds are something to be afraid of. So they developed this fear of birds, and that might not be the only thing that caused it, but it can play a role. So we know that there's something called modeling where you can model certain responses to your children, which can be helpful for helping them learn to cope with distressing topics or distressing feelings. I think that the important thing to note here is, yes, it can cause anxiety, but it doesn't so much matter what causes the anxiety. The same approaches are useful to help with it, whether it's a genetic influence or a life event that's very stressful or something caused by something your parent modeled.
That's interesting. Thanks, Michelle. Okay, so quite a relevant one in terms of returning from shielding or returning to the front line as a worker and having real anxiety about seeing patients and dealing with patients again, particularly with a prescription of beta blockers, which did not help. And the fear of constantly sweating, the increased respiratory rate, fogging the visor, which makes it really difficult to see the patient, and then deliver cytology and smears or do venipuncture or any of those more intricate interventions, and really not looking forward to going back at the end of April because really anxious about these sorts of things. Is there any helpful suggestions you have, Michelle?
Yeah, I think and this is really difficult. I think if you find that anxiety is so severe that it's making you not able to go back to work, or you feel like you can't do it, definitely seeking out help from someone who can help you more than self-help will be able to. I think that's really important. There are CBT providers who can help you with doing some of the things that we talked about, approaching your fears in a better way than can be done via self-help. But I think in general, the trouble becomes when we are anxious about something and we stop doing it for a while. That anxiety really builds up and kind of compounds as we anticipate having to be back in that situation. And a lot of times when we're actually in the situation itself, it's not as bad as we anticipate that it's going to be. So the first day might be really difficult, but the good thing about humans is that we tend to adapt pretty well to stressful situations. So not to say it's not hard or extremely stressful, difficult, but the apprehension about it can be more difficult than the actually doing it itself. So I mentioned there is a technique in daylight called worry exposure, and I find this one can be very helpful for kind of taking you through what is the worst case scenario. So in the app you could write something like, I'm worried about going back to work and panicking while I'm trying to do a medical procedure and that I won't be able to do my job. And then the app will take you through really imagining, okay, what would that look like? What would it be like? What's the worst case scenario? That sounds terrible to imagine that and really sit with that anxiety, but it's a form of exposure where we know that repeatedly kind of exposing yourself to that anxiety related to that worry can take the edge off of the anxiety. So repeatedly kind of revisiting that worst case scenario and thinking about how you would cope with it can make it less anxiety provoking. So I said a lot there. I hope there was something that's a useful takeaway.
Michelle, could I just, on the back of that, ask you a question, because there have been a few about this. Is online CBT as effective as in person? That question has been asked a few times in the box, so useful to get your response.
Yeah. So if you look at effect sizes, we can see that, so for daylight, the effect size is similar to what we see in in-person CBT. Of course, you want to have a head-to-head comparison, which is a trial that we're planning to do in the future. But other digital CBT or even self-help CBT has shown similar efficacy as in-person CBT. I think there's a couple reasons why. So if you think about it, having a weekly session and kind of learning something within that session, and then hopefully you'll do homework and things on your own, but you're really left on your own for the rest of the week. And these programs offer you an opportunity to really engage with the techniques and the times when you need them most. So it's kind of like having a 24/7 therapist in your pocket. Another thing to note is that it's consistent. So unlike therapists, it can't have a bad day. I say that as a therapist myself. But I think that research has shown that these things can be as effective as in-person care, but that's not to say it should replace it for everyone. So it's definitely a personal preference as to whether or not you really want that human engagement, because that itself can be therapeutic and helpful, or if you really just want tools to work on things like anxiety. So the research would say they're comparable with daylight. We're not entirely sure yet, but yeah, I think personal preference plays a big part of it. Amy, my dog, disagrees.
Have we got time for one more question? Or
yes, please do, and then I'll round it up.
That's fantastic. Right, okay, Michelle, I'll let you get the dog. That's fine. So. So this is an interesting question in terms of internalizing the perceived stress, which leads to insomnia. So how can someone get better at recognizing the symptoms really early on before they become out of control?
I want to make sure I understand. So recognizing symptoms of anxiety before they become out of control, or insomnia?
Yeah, recognizing the symptoms of anxiety before they become out of control, which contributes to insomnia.
Definitely. Yeah, I think so. Everyone is experiencing, most people are experiencing heightened anxiety right now. So I think the great thing about these CBT tools is that you don't have to have an anxiety disorder to do these, to engage in these techniques and for them to be helpful for you. So these are aside from being powerful tools to manage anxiety disorders, they're also just good coping. So if you notice that you're having a lot of worry throughout the day, that you feel very tense and on edge, even if you're thinking, you know, I'm not sure if this is at the level that requires medical care or a specific intervention, it's not going to be harmful to engage in these techniques. It's only going to be beneficial. I think the most important factors in differentiating kind of regular anxiety or not harmful anxiety from severe anxiety is noticing whether it's interfering with your life. So is it keeping you from doing the things that you want to do? Is it keeping you from having the relationships that you want to have? Is it keeping you from being effective in your work or doing things that you enjoy? And then just distress. If it's causing a lot of distress and you feel uncomfortable much of the time, that's probably a sign that it's something to work on.
Great, thank you, Michelle. I mean, colleagues, I'm aware that it's just a minute after 6 in UK time for your benefit, Michelle. Michelle, thank you very much. I'm just judging by the questions and the freedom with which people have felt to ask the questions, and obviously sharing their personal circumstances, etc., and the challenges they're facing. I think you've answered quite a lot of questions, the issues that people have raised. So that's real help for colleagues. I mean, colleagues, other questions that you've submitted, we will do our best to summarize them and try and answer them. Obviously, we may not get around to answering each and individual one, but certainly we'll do our best to answer the main ones that you've posed. I would say to you, a few of you have asked where how to access the Daylight. It is on the National Wellbeing Hub. We will circulate a link. Some of you have found it difficult, or I think you're accessing it the wrong way, is probably probably the best way of putting it. We will circulate a link to you, and if you want in the meantime to access it, it's on the National Wellbeing Hub, and it's on the Coping and Self-Care page, so you can access it that way. We will also be issuing tweets about it in the next couple of days, linked to encouraging colleagues to cope better with the change of hour and all that brings to those who work shifts and so on. So please access the hub for both Daylight and a range of other resources. And thank you for participating in today's webinar. All the best. Bye-bye.
Thanks.